This is Mrs. Harlan. We're discussing Chapter 19 today, Care of the Patients with HIV Disease and Other Immune Deficiencies. Remember that your immune system is extremely important for helping your body stay healthy. It helps to prevent the growth of all kinds of infectious organisms and abnormal cells such as cancer cells. And it just helps us feel a lot better by keeping that bacteria out. Acquired Immune Deficiency Syndrome, or AIDS. The first part of AIDS is HIV, Human Immune Deficiency Virus, and it can progress to AIDS. It's the most common immune deficiency disease in the world, and there is a serious worldwide epidemic currently. The cause of HIV is a virus. It is a human immune deficiency virus, and it's basically looking for a way into the cells and to force those specific cells into making more copies of the virus, of the HIV virus. And then as it makes a new copy of that, and these cells continue to look for additional cells to continue infecting, and this cycle just continues to repeat itself as long as there are new cells to infect. This is the HIV infection process, and what you need to remember about it is this HIV cell is deposited, for lack of a better term, into the body, and it goes looking for these CD4 and T lymphocyte cells. Your CD4 cells are important in helping to protect your immune system. They help they direct the immune system defenses, and it regulates all of the activity of the immune system. So when something goes wrong with your CD4 and T cells, then your body can get all kinds of bacterial infections. What the virus does is that it basically docks onto the CD cell, and it's kind of like a poison. It infects the CD4 cell with the HIV virus. This cell allows the CD4 cell, it messes with the RNA and the DNA inside the cell, and then it basically leaves. So instead of a normal CD4 cell helping to fight infection in your body, you have a CD4 cell that now is distributing the HIV virus and basically ruining the person's body. This is just a pretty slide that shows the life cycle of HIV, starting with the HIV virus here. These particular sites show where the HIV medications work best, and we'll discuss a little bit of that shortly. And then it also shows how the HIV virus starts converting your DNA and RNA into part of what they call the viral load. And so basically this cell is worthless as far as helping to your immune system to fight against infection. So some effects of the HIV infection. The new CD4 T cells, instead of, like I said, becoming cells that help our bodies fight infection, they are now basically an HIV factory. They continue to make new viral particles daily. So instead of having a lot of CD4 T cell counts in your body, that level falls and a viral load will start to rise. And we'll talk about the lab tests that measure the specific CD4 counts and your viral loads. Your immune system starts to weaken. Also remember that everybody has AIDS. Everybody with AIDS has HIV. But not everybody with HIV has AIDS. The HIV comes first, and if you can kind of remember the term HA, H-A, you can have HIV in your, you may not have AIDS, but vice versa. If you have AIDS, which is the more advanced part of HIV. Okay, and also remember, with early HIV infections, you can have an infection without the disease being evident. Your immune system can still attack and destroy some of the new virus particles, but with time, the number of the HIV particles will overwhelm your immune system. Those CD4 cell counts will start to fall, and basically your viral numbers, or the viral load, rise. And without any form of treatment, your patient will die of what we call an opportunistic infection, or cancer. And all an opportunistic infection is one that basically takes advantage of a weakened immune system. So there are 4 classifications for HIV, and they basically are defined in terms of what the CD4 count is. So with stage 1, it's a patient who has a CD4 count of greater than 500 cells per MM3, or a percentage of 29% or greater. So this means that at this stage they can still fight off the infection, and hopefully are getting treatment at this point. At stage 1, a patient has no AIDS defining illness. At stage 2, it's a patient with a CD4 count between 200 and 499, or a percentage of between 14 and 28. And at stage 2, the patient or person has no AIDS defining illnesses. So you start with stage 3 with the AIDS defining illnesses. It's a CD4 count less than 200, or a percentage of less than 14%. At this stage, they are starting to show signs and symptoms. On page 329, there is in the purple box, there are a list of disease processes that start the classification of AIDS-defining conditions. Some of them are considered wasting syndrome, lymphoma, which is a form of cancer, Kaposi sarcoma, which we will discuss shortly, histoplasmosis, these any type of recurrent bacterial infections, because the immune system cannot fight them off right now. Stage 4 is any patient who has a confirmed HIV infection, but they can no longer find any remaining CD4 T cell counts, and they are again starting to show signs and symptoms of the AIDS defining conditions. The time from the beginning of HIV infection to development of AIDS can range from months to years. It really depends on how the HIV was acquired, personal factors of the individual, and if they have received interventions yet or not. If a patient has been transfused with HIV contaminated blood, which happens only rarely in this day and age, but the HIV and the AIDS can develop a lot more quickly than a patient who has had who got HIV from a sexual encounter. What I just stated, it can take months to years. Personal factors can affect the timing, nutritional status, stress, presence of other STDs, and then again the frequency or re-exposure to HIV. Health promotion and maintenance. HIV is usually transmitted either sexually, parentally. Parentally is considered the sharing of needles or equipment with infected blood. Sexually, genital, anal, or oral sexual content. And then perinatal is of course crossing the blood-brain barrier in the placenta and going to the fetus. It can also be transmitted through breast milk from an infected mother to the child. HIV is not transmitted casually by sharing household utensils, forks, towels, linens, toilets, or any type of insect. Sexual transmission, the CDC uses the term ABCs. Again, abstinence is always the best way to limit your exposure to HIV. Be faithful to your partner, be monogamous, and then condom use can also cut down on the risk of HIV. Parental transmission, like I stated, is through uh, I just went blank. Uh, Parental transmission is through, again, sharing needles and syringes and other drug paraphernalia. There are preventive practices to help reduce the transmission among IV drug users, including the proper cleaning of needles, syringes, or drug paraphernalia. The book states that you can instruct your IV drug users to clean a used needle by filling and flushing the needle with clear water and then using a household bleach solution to clean the syringe. As we all know, not doing this particular process is best if they can get a clean needle, but using the bleach and water solution will at least help cut down their risk on contracting HIV. Perinatal transmission. Again, if you've got an HIV mother, it can cross the placenta during pregnancy and again go through the breast milk or through the blood-brain barrier. We as healthcare workers are always in constant risk for contracting HIV through needle sticks, injuries, exposure if you have open wounds, sores in your mucous membranes. Standard precautions are always best. We know our standard precautions are using our gloves, gowns, masks as necessary. And then, of course, post-exposure prophylaxis or PEP. If you ever get a needle stick, you always want to report yourself to the your so you'll want to go to employee health and let them know that you have had a needle stick. They will draw your blood. They will arrange to draw your patient's blood and test you and make sure that you're not showing any antibodies. And then again, they will test you approximately 6 months later. Testing plays a really good role in prevention because the tests are, again, a way of diagnosing HIV infection before there are immune changes with those CD4 cells. The primary healthcare focus for testing is to teach those who test positive, again, to modify their behavior to prevent transmission to others. So any sexually active person should really always know their HIV status. So again, a collaborative management is needed for HIV and AIDS. The assessment status is a person who's got HIV needs to be monitored on a regular basis. Again, for changes in their immune function or their health status that may indicate the disease has progressed to AIDS and any type of intervention that may need. The frequency of monitoring can vary from anywhere from 2 to 6 months. Again, it depends on the signs and symptoms and how the specific person is doing. But it's crucial to make sure they are keeping those follow-ups. You want to assess for subtle changes so that infections that may occur can be found early and treated. Ask about their age, gender, occupation, where they live, thoroughly assess their current illnesses, including when it started, severity of symptoms, and interventions that that particular person may have had. Of course, you need to know about their sexual history, whether they're an IV drug user, um, when the infection was diagnosed, and what types of things led up to that diagnosis, and then a history of what type of infections or problems that they have had since their diagnosis. Need to know if they've had any blood transfusions, and then, of course, like I said, sexual practices, STDs, and major infectious diseases. Physical assessment and clinical signs and symptoms. These people will be at a greatly increased risk for infections because, again, they're normal cells that help their immune system function properly are being changed into what we call viral particles, and these viral particles are spreading all over the body. So they'll be getting fungal infections, bacterial infections, opportunistic infections. So it's important that these patients are assessed anytime they start feeling differently. Opportunistic infections pose a threat for anybody that has an immune compromised system. Um, but we also have to remember that as healthcare workers, we must use appropriate precautions for ourselves and for these particular patients. So a lot of these patients may be on airborne precautions. Tuberculosis can be one of the opportunistic infections. So we as healthcare workers have to be mindful as well. Protozoal and fungal infections are common. Pneumocystic Jiavecchi pneumonia is the most common type of protozoal and fungal infection that these patients can get. It is considered a fungus, and for these patients, you want to assess for dyspnea on exertion, tachypnea, a persistent dry cough, and a low-grade fever. The patient may report fatigue and weight loss, and then you may hear crackles when you're auscultating the lungs. Toxoplasmosis is another infection that you may see, and these can lead to seizures, lethargy, and confusion. And then there are some malignancies that HIV patients can have. Kaposi's sarcoma is one of them. It's the most common AIDS-related malignancy. The risk for Kaposi's sarcoma appears to be related to a co-infection. You can see a small purplish-brown raised lesions. They're usually not painful or itchy. They can occur anywhere on the body, and in some patients, the lesions can develop in the lymph systems, mouth and throat, intestinal tract, or in the lungs. It's diagnosed by biopsy and looking at the lesion itself. Other malignancies can be malignant lymphomas, invasive cancers, HPV, or the human papillovirus, can also occur from this. HPV, as you know, can cause cervical and anal cancers. These patients need to be having a pap smear test every 6 months, and that is the basic standard of care for that. And then endocrine complications, body shape changes, adrenal insufficiencies, diabetes, and elevated triglycerides and cholesterol can increase the risk for cardiovascular problems. Many HIV positive men have low testosterone levels, and HIV women can have irregular menstrual cycles. As with any disease process, a psychosocial assessment is important. You need to make sure these people have a good support system. Ask about their ADLs, any changes that have occurred since the diagnosis. Make sure they're able to function at home by themselves if they do live by themselves. Check on their financial resources, including health insurance. And then again, they need to be abstaining from tobacco, alcohol, things along those lines. And then just to make sure they understand to plan care and monitor any changes, because again, getting these patients to treatment and care early on is the best way to keep them as healthy as we possibly can. Other clinical manifestations are basically signs and symptoms. AIDS, dementia is quite common with these patients. With the dementia, it refers to the involvement of the central nervous system. It occurs in about 70% of people with AIDS, and it can cause a lot of cognitive, motor, and behavioral impairments. These particular people can seem perfectly fine 1 minute and then being in a rage the next. Some of the neurological side effects that can go on, they can have peripheral neuropathies. They can also have paresthesias and burning sensations, reduced sensory perception, such as that you have with diabetes, and then pain and gait changes. The wasting syndrome is not due to any one single factor. It can be a result of altered metabolism in the body from cancer or from any type of the infections that occur. They can have diarrhea, malabsorption syndrome, which means they're not absorbing, vitamins and minerals the way they should, anorexia, oral and esophageal lesions that can make it painful to eat. It can also contribute to persistent weight loss, and then the patient can appear quite emaciated. Skin changes that can occur, dry, itchy, irritated skin. They can have all sorts of rashes. Eczema or psoriasis can occur. So we want to be asking about sensation changes, any type of rashes or irritation. And when their platelet counts are low, again, they can have the petechiae or have a lot of bleeding gums that can be present. Kidney problems are common. They can range from glomerular injury to acute and chronic kidney disease quite rapidly. And HIV patients have a significant higher risk for needing a kidney transplant. Laboratory assessment for these patients. Let's start with the lymphocyte count. Lymphocyte counts are part of your normal CBC when they do what we call a differential, and it's part of your white blood cell count. Patients who have AIDS are often leukopenic, which means their white blood cell counts are less than 3,500. They don't have those white blood cells to fight infection. The CD4 and T cell counts let us, as providers, know how many immune system cells they have in there. Again, those CD4 count or CD4 cells are those that help our immune system stay well, and it lets us know what the percentages are as to good healthy cells and how many HIV or viral particle cells that we have. People with HIV disease will have a lower than normal number of CD4 and T cells, whereas the number of CD8 cells will remain normal. The normal ratio of CD4 to CD8 is about 2 to 1. Antibody tests are used to measure the patient's response to the virus rather than to measure parts of the virus. So when the body is infected with HIV, the body makes an antibody to the virus, which usually occurs within 3 weeks to 3 months after the infection first occurs. The HIV antibodies can be measured by the ELISA test and the Western blot analysis. And sometimes these tests will be negative early on in the infection and then will become positive later as the disease process progresses. They're they're inexpensive. It's an accurate test, and they're a good test for measuring when a patient is first infected and when the cells are starting to replicate and they're getting more viral particles in the system instead of your CD34 cells. There are some false positive test results in about 0.1%. Home test, you can order test online to be sent to the house to do testing. Viral load testing is an extremely important test. It measures the presence of the viral genetic material that has been exposed to the CD4 test. It tells how much of the viral proteins are in the patient's blood. And they indicate basically the level of viral burden or viral load, and that is used to help monitor disease progression and treatment effectiveness. So as the viral load starts to go down, that means the treatment is working for that particular person. And then just again our blood chemistries, we want to keep in touch with all of our electrolytes, stool testing to see if these patients have blood in their stool, and then any biopsies as needed. Priority patient problems that we will see for these patients, again, because their immune systems are so low, they have a large propensity for infection, inadequate oxygenation. Inadequate oxygenation is also an extremely large problem with patients with HIV and AIDS because of the decreased immune system. They get a lot of bacterial and lung infections. So we want to make sure we're assessing their respiratory rate and rhythm, breath sounds, vital signs, and monitor them for cyanosis at least every 8 hours. Provide oxygen as needed and humidify the room as well. Pain can come from a series of things. It can result from organs enlarging, compressing nerves. If they've got tumor involvement, they can have bone pain. Tissues can cause pain, swollen lymph nodes, peripheral neuropathy. So just a lot of generalized joint and muscle aching. Diarrhea is common. Reduced skin integrity, confusion, reduced self-esteem, and then a potential loss of social contact due to the stigma of HIV. We're going to be wanting to monitor these signs and symptoms, and sometimes that's all we can really do for these patients. Give them comfort measures, pressure relieving, mattress pads, warm baths, massage, applying heat or cold. When we're lifting these patients or moving them, we want to take care not to put any additional pressure on them. Using lift sheets. These patients are very thin. They have poor circulation, and that too can contribute to pain and discomfort. And of course, have them change their positions quite often. We're not going to go deep into all of these antiviral drugs. Know that drugs that are used for HIV and AIDS, there are multiple drugs used together. You can see the different classes here, and they all work in different parts of the cell cycles. I just discussed enhancing the oxygenation through different types of medications, of course respiratory support and maintenance, and then rest and activity. And we've also talked about managing pain, comfort measures, pain medication, and then alternative measures. Nutrition is also a very large part of this. They have AIDS patients have trouble maintaining their weight and nutrition status because they do have a lot of malabsorption problems. It can be caused by fatigue, anorexia, nausea and vomiting, painful swallowing, diarrhea, or wasting syndrome. We want to maintain their weight, maintain their nutrition and hydration status. These things can be selecting foods that are high in calories and protein, maintaining their current weight, make sure they're drinking at least 2 to 3 liters of fluid a day as they can, and then maintaining normal blood levels of their ferritin. Remember, those are your iron storage, their albumin and hemoglobin. Sometimes diagnostic procedures are needed to determine multiple causes. So once the cause is determined, then we want to use the appropriate therapy. There are a lot of medications that can help, especially with fungal infections or thrush, and a lot of antibiotics and stuff. Basically, you will want to treat your signs and symptoms, monitor your INO, monitor your weight, monitor your calorie count, assess for food preferences, do all the things that we normally know to do. We can collaborate with the registered dietitian. And then mouth care is extremely important because that can help improve appetite. This mouth care can be delegated to an unlicensed person, and just have them, rinse their mouth with maybe some salt, not salt, but some sodium bicarb or sterile water several times a day. And again, minimize diarrhea with medications for these particular patients. Tissue integrity, we've already talked about minimizing diarrhea. We want to make sure that we're restoring skin integrity, analgesics, comfort measures, appropriate skin care, giving them back rubs, using lotion when appropriate as well. Because of the dementia that can occur, we want to reorientate the person frequently, using approved drug therapy, safety measures, putting the side rails up, making sure they have a clean, safe environment. And again, just hopefully they will have some family support or friend support through this time. Providing self-esteem is important, providing a climate of acceptance throughout the healthcare facility that they're in, promoting trusting relationships with their friends and family, encouraging them to speak how they're feeling and to identify positive aspects, allowing for privacy. We don't want these patients to feel isolated. And then encouraging self-care, as much independence as you can. And then you can also use guided imagery. Community-based care, if they're not in a hospital-based setting, then any type of home care management they may need, whether it's IV fluids, TPN, teaching self-management so that they can be independent, psychosocial preparation, and then any type of health care resources. Do not worry about this particular slide or this particular slide. We're not going to go into those particular types of deficiencies, and anything in your book that pertained to lymphoma or any of the cancers or malignancies you do not need to be responsible for. Thank you, and this is the end of our slide.